I started out with interest broadly in the sciences. My undergraduate degrees would be in physics and another specialization in physiology. So I did both of these. When you couple that with my passion for the heart, it makes a lot of sense where I am right now, considering all the different things that I've done in the past. Another anchoring point is imaging, and imaging research is really where I started out as part of my doctoral work. That's very quantitative, it's very physics driven, but the impact of what imaging can deliver is really in medicine. That's my feeling. So one of the major issues that is present with heart disease today is that the heart attack patients don't necessarily die right away, but there is a large proportion of patients who may actually die within 5 years. 50% of those patients may die. In some patients, what's happening is that, when you open up the arteries, the downstream smaller vessels actually burst. And we're still trying to figure out why those bursts are happening. But what we do know now is that a consequence of those vessels bursting is that even after that coronary artery is actually opened up, that bleeding is causing that part of the muscle to actually infarct or damage even more. But what we're finding is that when you open up this vessel, in some patients where you have these bleeds happening, the infarcts can actually double in size. But the story doesn't stop there. It continues to evolve, that when you actually have this hemorrhage happening in the muscle, this actually sets up a whole cascade of events. And one of the events is that it leads to delayed healing of the muscle. That is really the major cause of death in heart attack patients now. So in other words, we are not losing people right away as much as we did in the past, but we are losing people to heart failure in the post heart attack period. So there are a number of important implications in terms of both diagnostics and therapies for patients who may actually develop hemorrhagic infarction. Downstream effects of delayed healing can be treated potentially with therapies that can remove residuals from hemorrhagic infarction, but also the acute phase where the hemorrhage is actually causing damage and causing the cardiomyocytes to actually die, those can be stopped or prevented. There's also opportunities where we can actually identify at the time when we are opening up the vessel who's at the greatest risk of developing hemorrhage. And it's those patients that we would want to try and revascularize or reintroduce blood flow in ways that would prevent hemorrhage from occurring in the first place.